TCA side effects. Actually, the TCAs have a significant side effect profile, and that's why they are no longer preferred, because they are not selective and they don't just simply inhibit the reuptake of serotonin and norepinephrine, but they also bind to other receptors and they block other receptors, causing other side effects. So what are the receptors that are getting blocked by the TCAs? So first things first, you know that a TCA is classified as an antidepressant because it inhibits the reuptake of norepinephrine and serotonin, and this is beneficial in depression, but sadly, it also blocks the muscarinic receptors. So by blocking the muscarinic receptors, it exhibits anticholinergic side effects, such as the urinary retention, the blurred vision, the constipation, and the dry mouth. Also, since it blocks the muscarinic receptors, it can block particularly the M3 receptors located at the bladder, and that can worsen the BPH, which is the benign prostatic hyperplasia. Also, it blocks the histamine receptors, particularly the H1 receptors located centrally in the brain, and that causes severe sedation, such as the first-generation antihistamines. So what is the clinical implication of that? The clinical implication of that is that you want to avoid the TCA if the case scenario tells you that the patient is, for example, a taxi driver or a truck driver. So his job requires him to be alert. So you don't want to prescribe something that causes him severe sedation. So avoid if the patient requires alertness or if he is dealing with heavy machinery, for example. So every side effect can actually correlate to a type of question. So another thing about the TCAs is that they also block the alpha-1 receptors. And we know that the alpha-1 receptors are present in the blood vessels. And when you actually block the alpha-1 receptors, that causes severe vasodilation, and that causes the blood pressure to drop. So it has a side effect of orthostatic hypotension. And that's why actually the TCAs are not preferred in elderly, because we fear that if we gave them to an elderly person, they would have a hypotension and they would drop and they would fall, and that would lead to fractures. And you know that fractures and bone fractures are significant in elderly and they are difficult to be recovered from. Now, another thing that the TCA does is that it blocks the sodium channels. And by blocking the sodium channels, they basically act as the quinidine, which is an antiarrhythmic drug. So by blocking the sodium channels, they would induce arrhythmias. And this arrhythmia side effects is typically seen in the amitriptyline. So the amitriptyline TCA is specifically correlated with the arrhythmia. So remember, the A for the amitriptyline correlated with A with the arrhythmia. Another possible exam question is they tell you, how do you deal with the TCA toxicity or the TCA arrhythmia? Because we know that tricyclic antidepressant arrhythmia is mainly due to the blockage of sodium channels, because you have a very high doses of the TCA so that they will start binding to the sodium channels accidentally and block them, causing the arrhythmia. So how do you deal with the TCA toxicity or TCA arrhythmia? Because actually experiencing arrhythmia with TCA is a sign of toxicity, in other words. So in this case, the solution is to give them sodium bicarbonate, because sodium bicarbonate, they counteract the blocked sodium channels. So this is how to deal with amitriptyline toxicity or TCA toxicity, which is the arrhythmia. You fix it with IV bicarbonate.